Is a colposcopy always needed after an HPV test? Imagine going for a routine checkup and hearing you tested positive for human papillomavirus, or HPV. You might wonder if you need a colposcopy right away. The truth is, not always. Whether a colposcopy is necessary depends on several factors. First, it depends on your test results. If you have an HPV positive result but your pap smear shows normal cells, your doctor usually recommends waiting and doing follow-up tests in 6 to 12 months. This allows time for the infection to clear naturally, especially if it's a transient infection. If the follow-up tests still show HPV positivity or abnormal cell changes, then a colposcopy might be advised. Now, if your HPV test is positive and your pap smear shows abnormal cells, like atypical squamous cells or low-grade lesions, your healthcare provider may suggest a colposcopy. This procedure helps to look closely at your cervix to identify any areas of concern. Sometimes, if you have two consecutive HPV-positive tests, even if your pap smear is normal, guidelines recommend a colposcopy. This is because persistent HPV infection can increase the risk of cervical changes that might develop over time. Other factors also influence the decision. Your age matters. Older women or those with a history of cervical abnormalities may be more likely to have a colposcopy. Younger women often clear HPV infections more quickly, so doctors might prefer monitoring first. The specific type of HPV also plays a role. High-risk strains are more likely to cause changes that need closer examination. Overall, the approach is personalized. Healthcare providers consider your medical history, previous screening results, and risk factors. They follow guidelines from reputable health organizations, which emphasize a risk-based approach. So, in summary, a colposcopy is not always needed after an HPV test. It's usually recommended if there are abnormal cell changes, persistent infections, or other risk factors. Always remember to discuss your results and next steps with your healthcare provider, who can give advice tailored to your specific situation.